Now let's start the assessment of this beautiful girl. 很漂亮. Now, I notice the presence of the nasolabial folds. And also, please observe the position of the brows. I would like to have a close-up look now, please. When we have a close-up look, open your eyes, we notice that the cheek position has changed. I can see the presence of tear trough and nasolabial folds. Take a look when the patient tilts down, especially in the oblique veil. We notice that the position of the cheek is causing the presence of a deep nasolabial folds. So to improve the nasolabial folds, in her case, I needed to give support for the cheeks in the points L1, L2, and then we're going to verify if I also need to inject L3. The other question is, should we also inject the direct approach in the nasolabial folds? Let's observe when she smiles. Smile, more, teeth. When she smiles, we notice that the nasolabial fold gets too deep at the canine fossa and the nasal flare widens. So that means I need the indirect and direct approach to her. So, during the assessment, I have to review. When I have ptosis of the cheek causing the nasolabial fold, I need to give support with the lifting codes. However, when the patient smiles, presenting a deep nasolabial folds and widening of the nasal flare, I also need direct approach. Now, let's proceed with the marking. When I look at the marking, open your eyes, zoom in please. I ask the patient to chin down and put eyes up. Eyes up. Then I mark the transition of the lower eyelid and the cheek. This is very important for me to make sure that I do not invade any area that is considered distracting. After this, I palpate to feel the presence of the indentation on the bone. And this is where I mark L1. Now let's proceed with injection of L1. I get Juvederm Ultra Plus. Pinch and retract the skin so that I lift the nasolabial fold. Pinch, go deep plane, aspirate, and we inject 0.1 ml. Gentle massage. So now, after injecting L1, we notice the change in the shape of the face. It gets more lifted. Also observe what happens to the junction and observe what happened to her eyebrows. If you really look at the position of the eye, we notice a very beautiful improvement. And I'll ask her to smile. Smile. Take a look when she smiles. what happens to her cheek? It got slimmer. Now, let's mark the point, close our eyes, L2. Now going to point L2. Cleaning, lift, pinch, deep plane, aspirate, and inject 0.2 ml. Gentle massage. Now observe what has happened after injecting. We notice that time by time her eyes is opening, and when she puts down, we notice that her cheek is much more lifted than on the other side. Smile. Take a look, the beauty that she has on her cheek. Now let's mark point number 3. Don't forget to remember the position of the infraorbital artery. Point number 3 is lateral to the infraorbital foramen. Now let's proceed with point number 3 to give a very beautiful young look for this patient. Protect the foramen, protect the orbit, lift the nasolabial fold, and inject deep. Aspirate and inject 0.1. Now let's observe what has happened into the nasolabial fold. Take a look at the difference in the nasal flare. Also take a look in the difference of a younger appearance. Now smile and we notice the change. Now it's time to inject Juvederm Ultra in the nasolabial folds. Now let's observe the treatment of Juvederm Ultra in NO1. It's a superficial injection. And we very slowly inject 0.1 in NO1. And NO2 and NO3. Now, let's check the treatment of L1, L2, L3 with Juvederm Ultra Plus and NO1, NO2, and NO3 with Juvederm Ultra. Take a look what has happened in her facial shape. The treated side, we notice a very much improvement of the position of the cheek because of the indirect approach, and also the change at the level of the nasolabial folds. Can you zoom in, please? Take a look, the change of positions of the brow, eyes, and also please observe what has happened in the nasolabial folds when she smiles. Take a look, when she smiles, we notice that the cheek smile and the nasolabial fold are much softer on the treated side. pencil. Now let's mark the other side. So first, palpate L1, check L2, be careful with L3, and mark it. So, with the other half of the syringe, we retract, we pinch, and inject 0.1 in L1, 0.2 in L2, and protect the foramen, retract, and inject 0.1 in L3. Proceed to the treatment of the nasolabial fold direct approach using Juvederm Ultra, because her nasolabial fold is not deep. We inject very superficial in the subdermal plane in NL1, going to NL2, and NL3. Smile. I still can see a very tiny indentation, so relax, clean, and inject again in NL2. So this is the immediately after result of the MD codes L1, L2, L3 with Juvederm Ultra Plus, and NL1, NL2, and NL3 with Juvederm Ultra. We can see a very beautiful and natural result with the patient immediately after when we use Juvederm Ultra and Juvederm Ultra Plus. We see the change in the position of the shade, and we see the change also in the shape of the face. Zoom in. As well as when she smiles. Smile. We notice a younger type and more adolescent smile.